Today I'm joined by Dr. Haviva Malina. She's an ER medicine physician with over 15 years of experience, and she became a big proponent of ketamine therapy for depression, anxiety, PTSD, and mood disorders after her time in the ER during the pandemic. And now she and her sister-in-law have open centers across the New York City and a few boroughs nearby. And we did talk today about the use of ketamine therapy and how it can play a role, particularly in treatment resistant PTSD, anxiety, depression. We talk a lot about how to use it, when it's therapeutic, and what it is and is not. And I think it's really important because therapies like this can do a lot in a very short period of time. So it has an immediate effect, particularly on depression. And so today we really go deep into that. We talk a little bit about why this may be a treatment option, particularly during perimenopause and menopause and the stress during that time, and how it is really done. And so join me today on Menopause Mastery with Dr. Haviva Malina. All right, Dr. Haviva Malina, this is a really great conversation because women deal with so many mood issues, and obviously it's very much related to hormones, but I would say that the current treatment that is what we use particularly in perimenopause as the sort of stopgap for all symptoms is your SSRIs with I would say
Mhm.
limited if at all benefit. And what we're going to talk about today is, I think, so exciting because there's been research for decades and it's just now getting out into clinical practice. And I think there's so much stigma and misinformation that I think all women need to hear this both for themselves and their families. So I really thank you for joining me on Menopause Mastery.
Thank you for having me.
Absolutely. So tell me how did you get into particularly mental health, mood, and then especially ketamine assisted treatment? How did you
Yes.
get there?
Yeah. Keta Medical Center is founded by myself and my sister-in-law, who's also emergency medicine physician. And we've been in practice for about 15 years as ER doctors. COVID hit, and that was sort of a turning point for us. I think we saw sort of the mental health pandemic emerge in a way that was often extreme in the emergency room. Women and people in general were, neglecting their mental health, which we saw sort of the ripple effect afterwards. And even today, there's sort of traces of it. And we were both intrigued and inspired at the time to sort of turn our focus from the emergency room to mental health. And we have been using ketamine. Like you said, it's an old medicine. It's been around for many decades and been established for use as an anesthetic in higher doses. And so in the ER, we were routinely using it for other things. And then we sort of got interested in its use for mental health. And we sort of did research, kind of reached out to many psychiatrists that we had connections with. And we had some exposure to ketamine in that context. And then we started, we opened up our first office in New Jersey, and we said, we're going to see how this works. And as sort of the patients went through the process of undergoing their ketamine treatments, they emerged on the other end, and we saw how transformative it could be, how safe it could be, in the proper sort of medically supervised context. And we were taken by it. And that was 3.5 years ago. And now we have multiple clinics in New York and New Jersey, basically with the same mission, which is to provide ketamine in a safe, supportive environment to people who need it.
Awesome. Awesome. So I'd like to help distinguish for the listeners, the different types of medications that we use for mood issues, because there's a wide variety and most people don't have any idea how these things work.
Absolutely. So, I'll bulk them into the category of traditional antidepressants. And they all work in similar ways to different extents on what we call the dopamine and serotonin pathways. They the concept is that mood issues are fundamentally related to these pathways or to lack of stimulation of these pathways. And the goal of things like SSRIs or SNRIs are all geared towards that primarily. Ketamine works fundamentally differently. So it kind of approaches an old problem from a new angle. And like I said, it's a medication with a new use. So while it's been around for a long time, it's never been applied until more recently to this problem. But I tell my patients, this is something that's sort of reassuring to me about ketamine because it's been around for so long that it sort of stood the test of time. We're not talking about a new medicine with a new use. It's an old medicine with a new use. But what it does, it works in multiple ways and it kind of wears multiple hats. But the unique way in which it works is that it works on the glutamate pathway. And what it does is there's an NMDA receptor in the brain. And what ketamine does is it blocks that receptor. Now, that receptor blocks glutamate. So if you think of it as sort of a double negative, it blocks the blocker. So it unblocks, it opens the channels for the glutamate to pass through. More glutamate is better in terms of mood, motivation, and it has a direct antidepressant effect, glutamate, but it also works to promote the process of what we call synaptogenesis, of literally forging new pathways in the brain. So by creating these new pathways, just this process alone is very healing for a patient's mental health. Because what we see that it does and what we see reflected in the patient experience is that patients are able to see an old problem in a new way, to circumvent old ways of thinking, behaving, responding to, let's say, emotional triggers or situations that are difficult or depressing or anxiety provoking, and kind of being able to open their eyes to a new way of approaching the same problem. And this is truly the key to ketamine. And this is why ketamine has had such an impact and is able to sort of move the needle with people's symptoms in a way that traditional antidepressants just can't. And this is aside from the very unpleasant side effects that some traditional antidepressants may, carry with them. So, patients can experience weight gain. They can, with traditional antidepressants, they can experience, decreased sex drive. They can experience a lot of things that makes sometimes the medication worse than the original ill. And so compliance may be poor on some of the antidepressants. What I sometimes see is a lot of patients, when they have their meds, adjusted, they'll just switch from an SSRI to an SNRI, and it's just kind of playing with the same set of cards. When you introduce ketamine, it's literally introducing an entirely new way of approaching, for some people, decades worth of struggle and depression.
Yeah, I'm so glad you pointed it out because, the medical community of which I am a part of, hand out SSRIs like candy, especially to women. It's the answer for everything. And especially in perimenopause, we're already experiencing, most of us, weight gain. We're already experiencing low libido and sleep interruption and all these other things. We're adding that drug on top of it is going to exacerbate it. And then some of it, almost all of them contain warnings about suicidal ideation too. So they're not necessarily benign on top of that.
Right. I think it's a lot of sort of inertia, like psychological inertia, and not, just doing the same thing again and again and not realizing like maybe we have to think outside the box. And the nice part about ketamine, I think increasingly it's been more accepted in the medical community as a viable option. And I believe that the threshold should be lower before we start waiting till, a patient fails, and by fails, I mean doesn't respond to or, can't take, can't tolerate, an SSRI or an SNRI, or the like. And so that's what we're trying to get out there. So, we opened these clinics to make this accessible for our patients, but we also did a bit of education in the psychiatric community in terms of, we're physicians. We have certain medical standards. We're doing this because we really think it can help, and we hope that the patients that return to their psychiatrist will be like, this really helped. Maybe it can help some, other patients, and it'll sort of have a snowball effect. That's our hope.
Yeah. Yeah. It's just a lot of stigma around it. Now, I want to make sure we cover because this gets looped
Mhm.
into several other drugs. So NMDA, so I want to go back and sort of step on that because those of us from the 80s might remember the street drug name ecstasy
Right.
that was out there. And so it gets that stigma. And then there's also psilocybin and the psychedelics. So it sort of gets looped into a psychedelic, but it's not quite the same in its mechanism. So can you distinguish those? Because some people are like, man, I'm not doing psychedelics. It's like, well, it's
Right,
not really
right.
that.
So what I alluded to before was that ketamine wears a lot of different hats. And so it does have transient psychedelic effect during the actual treatment, but it is short-lived. So during the actual ketamine treatment, people can feel a little detached from reality, kind of like a little bit of a dreamlike state.
Mhm.
Um, I find that this actually helps a lot of patients that are suffering with PTSD, where they are able to have that sort of emotional distance from some of they want just that relief from the burden of carrying that trauma around all the time. So I actually find that even in the short term, it can be helpful for some patients. But regardless of what happens during the actual treatment, the ketamine is building up in your brain and doing the things that we know it does best. Um, so, ketamine has that psychedelic property. And so, therefore, it can be looped in the category with psilocybin and some of the other psychedelics. Um, those other psychedelics have to be distinguished from ketamine. Ketamine is a bona fide medication that's, like I said, used in the medical community, established. It's an FDA approved medication. Again, it's used for other things like anesthesia, sedation. And part of the reason it's helpful, for instance, in sedation, is it gives that if somebody comes into the emergency room and has a shoulder dislocation and they need it relocated, you can get ketamine, and guess what? You won't remember exactly what happened during the treatment. It won't be traumatic to you because you have that kind of you know, that you had that transient effect. But the idea is that it's similar. There's overlap in the Venn diagram, so to speak. There is overlap because it
Mhm.
carries that property. But psilocybin and the other psychedelics have not yet been approved. There's no protocols in terms of how it's been studied. Ketamine has been studied for 10 to 20 years in the IV form. Spravato is the nasal spray, and that is FDA approved for treatment-resistant depression.
Yeah,
So if
just got
anyone's
approved, as a matter of fact.
well, so it's
Oh, so wait,
been
no, it's been
FDA
approved, but it's actually getting reimbursement. There we go.
approved. Right, exactly. There you go. You got it. So that's actually very hot off the press as of like less than 2 weeks ago. It was approved as a monotherapy. So it can be used without a concurrent antidepressant, which is really big news and can make this medication that much more accessible for people that, like you said before, just can't tolerate the antidepressant. So, you know,
Yeah.
it should check all the boxes with people that are scrupulous about the medical aspects and the medical safety. And, it has to be medically supervised. So it's an in-office treatment with physicians and nurses. But assuming that that's in place, it's really an incredible option.
Yeah, and I think you sort of mentioned this, but I'd like to kind of go back to it because it is a therapy that's administered in clinic and has a fairly short half-life as far as it's not like you're going to be kind of otherworldly for 3 days. It's very short acting on your system so you can go in for treatment. But it also means it has an immediate effect. I think that's really important because even in the drug trials, whether you love them or hate them for the
Mhm.
conventional treatments, you're looking at weeks and weeks and weeks before you know whether you have any improvement or not.
Exactly. Exactly. It takes, right, like they say 4 to 6 weeks for the traditional antidepressants to take hold. For Spravato and for intravenous ketamine, we see patients sometimes within days, and it can be progressive. So they'll initially see some subtle improvements where they say, I wasn't as reactive in this situation. I was able to tolerate this. I was able to take that morning jog and get up in the morning, and I didn't think there was sort of like that automaticity and the routine that usually is much harder for me. I was able
Uh-huh.
to socialize. I was able to go out on Saturday night with friends, and I didn't have that anxiety or you know, that depression. So, it's really incredible to watch.
Yeah. So do you do both the IV and the nasal, or do you primarily lean into IV? Which I think both have obviously efficacy, but
Yes. Yeah, we do both. We offer both, and each patient can have their own sort of calculation. The Spravato is FDA approved, so it can be covered by insurance. Intravenous ketamine is still off label for psychiatric reasons, so that would be
Mhm.
an out of pocket expense. But they're both. We see similar effects in both. The protocols are a little bit different.
Mhm.
The schedule in terms of the visits are a little different, but we kind of walk our patients through in the initial consultation in terms of what makes the most sense for them.
What would it kind of look like? So someone would come in to get ketamine. Do you do some intentionality around the experience and kind of here's like sort of I always think of it as a Sherpa. It's like, okay, you're
Right.
going on this
Yeah.
event or trip, not a crazy
Yeah.
trip, people, just a trip.
Journey.
A journey, and then but you need but you wanna go into it with, like, a little bit of a roadmap and an expectation so you get the most out of it.
Absolutely. So we tell all our patients, and I think just even biochemically, with this, what we call the neuroplasticity, the dynamic nature of the brain, it really is important to sort of capitalize on the ketamine treatments and do that pre and post. Ketamine plus therapy is superior to ketamine alone, for
Yeah.
sure. And I think we like to fashion ourselves as sort of medically supervised, but very individualized in terms of we really tailor each patient's journey, experience, and mental health trajectory in a very specific way for them. So what we do offer is we have a ketamine-assisted psychotherapist that's on staff, and we also have a psychiatrist on staff, but many patients have their own providers, and they come referred to us. But we do have this ketamine therapist who's excellent, and she will meet with the patient beforehand, even a day before to kind of set intentionality, exactly what you said, what to expect. During the actual treatment, we have ketamine playlists, ketamine meditative options, an eye mask, a journal, to kind of guide, we kind of shepherd our patients through the process. And then post treatment, again, you want to take advantage of this, what we call the neuroplastic window after, to basically these new pathways that are created, you make them more permanent so that they become the new ways of thinking and not sort of a transient experience. So it is very important to do that. And that's an option for after the treatment, to kind of process exactly the integration is what we call. So
Yeah.
absolutely,
So how
that's
long is that sort of integration window, that plasticity window where you get the best benefit? I would say it's probably got a little bit of ongoing, but you have probably this
yes.
very, very big sort of window that if you did intentional things around it, like, you don't wanna go back and have, like, a really stressful day at work after your ketamine treatment, I would think.
Right. Right, right. So I would say like, a few days to a week, after the treatment. But typically when you're in what we call the induction phase of kind of getting the ketamine into your system, where you're coming in more frequently, you'll have, let's say, twice for Spravato, for instance, you're going to be coming in twice a week. So, there's no exact recommendation, but the idea is just to meet with the therapist so that you can integrate some of the things that came up during the treatment that was brought to the surface to channel it in the most positive, constructive ways.
Yeah, so obviously treatment's not a one and done. Sorry, people. It'd be nice to be
Yeah.
like, "One and done, I don't feel bad anymore." But it has obviously like anything, you kind of get in there and you really work at it more closely with closer, with appointments that are in closer proximity, and then it sort of spreads out. What would be kind of the average for somebody?
So for Spravato, it's you're coming in twice a week for 4 weeks. And then it goes
Okay.
down to once a week for 4 weeks. And
Okay.
thereafter, there's a maintenance program where we can kind of tailor it. Obviously, life is dynamic and life circumstances change, of course. So, we can figure out what cadence works the best for you.
Okay.
And that cadence can change, right? Like you can be doing great for a while and not need to come in, and then you need to come in more frequently. For IV ketamine, the induction phase is 6 infusions over 3 weeks and then boosters
Okay.
down the road. So
Okay.
we kind of work with our patients to sort of individualize. We realize it's an art and not only a science.
Yeah.
So.
Yeah. Do you have a preference between the two? I mean, I know obviously a patient might be like, oh, not needle phobic and prefer the nasal.
Right.
But
Right.
like in my brain, I'm like, however, the IV ketamine is more precise.
Right. So there are pros and cons to both. The IV ketamine, the induction phase is a little bit quicker, so it works a little faster. And you can titrate or calibrate the dose. It's a weight-based medication, so it's a little bit more precise. On the other hand, Spravato, I find, has very similar outcomes in
Okay.
terms of efficacy, in terms of sort of ultimate goals. The maintenance schedule for Spravato, because it's FDA approved, has a little bit more of a regimented schedule where you're sort of kind of slowly titrated down a little bit more delicately. But both have, and like I said, Spravato is FDA approved, so it can be covered by insurance.
Yeah.
So that can be a practical consideration for many people.
Yeah. I guess it's too early to know whether it actually truly, because they'll say approved for insurance, but that doesn't necessarily play out in the real world.
Right, exactly. Sometimes there's a lag. Absolutely. There could be a few month lag with that. But my
Yeah.
office staff is great with the billing stuff and we'll take care of all that.
Yeah, yeah, for
Um,
sure. So let's talk a little bit specifically around, why you might see women in their 40s and 50s seeking out this treatment. Obviously there's a bunch going on with hormones, which I've talked about. But if we look at the stats, at least one of the more recent studies I read, it was like 3 in 5 women experience depression, 1 in 3 experience anxiety as a primary symptom of perimenopause. And it's not all just the hormones. Yes, I would love to say
right,
that's true, but it's not.
right,
So let's
right.
talk about that a little bit.
Right. I think women have sort of unique challenges that predispose them to sort of mental health issues. And while at any age you can struggle with depression, anxiety, and there's always sort of the intersection of biochemical, genetic, and stressors, environmental factors that always play a role to different extents at any age. But I think that what we've noticed in our center is that women can struggle earlier on in their lives, in their motherhood years, where they're continually sort of emotionally giving to others, sometimes neglecting their own mental health wellness. And then later on in life, where there's also that common thread of hormones and environmental factors, where maybe they're experiencing an empty nest syndrome or midlife crisis issues, combined with these hormonal changes to kind of create this perfect storm of an uptick in depression and anxiety. And we have patients that 18 to in their 80s. I mean, so really kind of can span any time. But I think that what we've noticed with our patients is that women can struggle with, unique set of issues in their menopausal years. And we try to sort of help people during that time. And I think as women co-founders, we hope that patients feel comfortable, coming to our center and knowing that their needs will be met.
Yeah, I think, so much of that kind of weighs heavy because women end up putting everybody else in front of themselves. It's, if it was their kid, they're going to spend it, or, they'll take the time out of the day, or, they'll take care of their
Right.
mother and all this other stuff. And I'm like, yeah, but you can't, if you can't take, care of you, how were you supposed to take care of anybody else? But we always do that in this very weird way
Right.
and struggle.
Right. We always do it to our own detriment, and yet don't learn to maybe step back. And I think there's sometimes this double standard with women and men where if we're haggled and frazzled and emotionally, challenged, it's perceived differently than men. Maybe men are just very busy and ambitious in their career, and we're just sort of struggling to manage. So I think there's definitely that unfair expectation, and we do it to ourselves, like you said. It's not, it's certainly not, it's something that I'm aware of, as a mom, and being able to sort of balance everything is difficult, and we always put others first. So certainly.
Absolutely. So that brings me to the next question, because often, moms, grandmas get involved in the care, particularly of their grandbabies, and babies might be big babies at this point. But so from a ketamine treatment standpoint, what age groups I mean, obviously adults, but what age groups would ketamine also be good for, if they're not, let's say 30 and above?
So, we have treated patients, 18 and older. Like I said, we have a geriatric group of patients, 80s plus, and it really spans time. I mean, we have a lot of like teenagers, 18, 19, that come with their parents, and their parents are very involved in their care. And very often they've been struggling with symptoms for a bunch of years, high school, and into college, and their parents are very involved in their care, and they come to the appointments, and they're involved in the treatment plan because they're part of the process.
Yeah, yeah, because yeah, so mostly adults, I guess, but is Spravato isn't approved for children, right?
No, not
I
yet.
didn't think I
Not
didn't
yet.
think so, and I was
Yeah.
like, yeah.
Yeah, I mean, we have some patients that are in their 80s who have suffered with depression on and off,
I love
SSRIs, SNRIs, tinkering here, just sort of moving pieces around and never really experiencing the relief. And then when they have ketamine, they're really, I mean, they feel that it really can transform them. So it's really amazing.
Yeah.
So I
Now would
would
this
love
be
not to treat 80-year-olds. I'd like to
Yeah.
get them relief sooner and lower the threshold to be able to consider this as an option for the right type of person.
Well, and if you look at people in that age group, they went through decades of just stigma where no one talked about it. You were just supposed to be tight-lipped about it. Now we talk about it, but we have treatments that aren't very effective in many cases until you get to like the psychedelics and the ketamine and things like that. Is there any potential risks to doing ketamine that we haven't really covered in a clinical setting with appropriate, treatment protocols and things like that?
Right, so we always do screening to make sure our patients are appropriate, both psychiatrically and medically. So there are a list of reasons, what we call, contraindications, reasons you cannot get ketamine, and we
Mhm.
make sure that everything is squared away with that before we start. But once you start, it is extremely safe as long as it's medically supervised. So unregulated doses in uncontrolled settings, I can't speak to that. Any medication can be abused in the wrong way. But as long as it's medically supervised, it's, like I said, an old medicine with a new use. And it really, and people have different degrees of effect. Like for some people, it can be that they see subtle changes or, moderate improvements. But in particular, in things that were stubborn for a while, like things that were refractory to treatments, or at least the treatments that they were on, suddenly like they can make headway or have a new lease on life as a result of being able to sort of crack an old problem or you know, stubborn PTSD that was sort of handicapping them.
Yeah. Yeah, I think that's really valuable, just, that there's always an opportunity there. So tell me, where do you see your ketamine assisted treatment going? So obviously you've got clinics in New York and New Jersey. Right? New York,
Yeah.
New Jersey, that's correct?
Yeah, New York, 2 in New York City, 1 in New Jersey, 1 in Westchester, and we're opening in Brooklyn next in about a month and a half.
Awesome.
So, we find that actually we have a lot of patients that come to us from Brooklyn to Midtown, so we feel like this would be a good next step. I mean, we hope to continue expanding, educating, and just getting the word out, and really trying to make people aware of how safe and effective this can be for many people.
Yeah, absolutely. Absolutely. So where if my listeners wanted to, look you up, maybe they're in that area or maybe they go there quite a bit, how
They
can they find you?
Yeah, absolutely. So they can find us on, they can access us on the website, Keta Medical Center, which is ketamc.com. Call our office or text us. And the first step is a consultation with me. So I do all the consultations to kind of get to know each patient, free consultation. Kind of give them a little bit of background and fill in some of the gaps, answer questions about ketamine, and get to know them and kind of see where their goals are and what they're looking for and see if they would be a good candidate for the treatment. And then from there, I will coordinate with our primary psychiatrist and therapist. So if they have providers on the outside, I like to kind of come up with a comprehensive plan and that there's open lines of communication. That's also
Yeah.
something that's very lacking, and very splintered in the sort of mental health world where somebody will see one therapist here, they get prescriptions from somewhere else, and there's sort of no communication between the two providers. So what I try to do is kind of close that loop for people. And I will stay in touch with their providers to let them know how the ketamine's working, how they're doing, and encourage that collaboration, which is very beneficial. I mean, I feel like it's important on my end to do, but it's very
Hmm.
beneficial for our patients. Then they can see our in-house psychiatrist or a therapist if they don't have. And then we kind of talk to them we'll give them a little introduction about the actual treatment and walk them through everything. Our staff is very much chosen based on a certain set of skill set, which combines sort of medical expertise with an understanding of people's needs and a good bedside manner. So that is really our focus. Where myself and my sister-in-law, Dr. Haviva Malina, are heavily involved in the day-to-day of the centers. So we
Absolutely.
want to make sure that our patients are well taken care of. So.
Yeah, it's interesting because I am. So as a disclosure, everybody knows I share everything. I've shared my
Yeah.
genetics as a as a podcast, but I actually did a series of treatments with Spravato.
Okay.
Because we have psychiatry in our office, so it was okay. Well,
Yeah.
before we do this, I need to know what it's like. And it's actually so for anybody that's like, oh, I don't want to feel out of this crazy out of body or what that might feel like. It is I would say, and you could probably help if this is true, but what
Yeah.
what was true for me was I felt a little giddy, right? So like
Mhm.
you're kind of smiley giddy, and you feel like a
Mhm.
sensation of floating
Right.
and kind of everything's a little more colorful, everything's a little more friendly. I was a
Mhm.
little bit sleepy, but I think I was sleepy that day anyway. But we had set up an intentionality, and I was listening to a meditation, I was kind of walking through that mentally, but it was not this very scary, like I don't know what's going on, or I'm out this
Mm.
way out of body experience. It is a very sort of what I think of it like is you watch little kids playing, like little 3 and 4 year olds, and they're so into what they're doing, right? Like when they're playing and running around, nothing in the rest of the world is going on around them, but they're so into the moment. To some degree, there's this childlike playfulness in the moment sensation that's happening at
Right.
that time. At least that's what it was true
Right.
for me.
Did you feel a little kind of removed from your life, like peering in? That's what a lot of our
Yes.
patients feel, that they feel like they could be out in space or wherever, but that they feel like their life is a little bit dissociated from where they're at.
Yeah, there was a sensation of yes, sort of being tethered to myself where I could be an observer of my own experience rather than being in the experience that almost like you're sitting on a park bench watching your life transpire unfold rather than just being right in the middle of it, which I think is valuable because that's where the insights come in. It's like I'm detached from that experience. look at it in a different way and come up with a new set of discussions and other things. But it
Right.
wasn't scary. Like a lot of people are like, is it scary? I'm like,
Right.
now, if you're a super type A control freak, you know, you probably just need to know that you're going to feel a
Right.
little removed, but it's not bad. Yeah.
Right, right. You need to be prepared and also to understand that whatever experience it is, it's okay. Like there's no right and there's no wrong. In order for the ketamine to work, you don't have to have follow this very specific path. It's like
Mm-mm.
if you enjoy listening to the ketamine playlists we have, great. If you enjoy, doing the meditative exercises, if you want to just close your eyes,
Mhm.
a minority of people like to journal. I would say that's a
Mhm.
minority of people,
Mhm.
but those are all options and they're all fine and good.
Yeah.
Um, so yeah. Did you
Yeah.
feel an impact in your mood or motivation? Did you feel a
Yeah.
little
And
light?
yeah, I would say, in complete disclosure, I don't personally, at least at this time in my life, have a problem with depression. But there was definitely this feeling of like new opportunity, like everything feels a little more like a
Cool.
possibility,
Uh-huh.
and a little more decisive about that, I would say, you know?
Yeah.
Yeah.
Interesting. Yeah.
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 So it's not the scary thing because people think it's gonna be like, one of those terrible movies, you're probably not old enough, this like from the '70s, Reefer
Right.
Madness, but something like some of those crazy, like what they saw
Right.
on some sort of terrible
Greek.
B
Right.
movie. It's not that.
Right. 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 Yeah, no, for sure.
For
Yeah,
sure,
our
for sure.
patients describe different experiences and also even the manifestations of the improvement obviously is different. Like that
Mhm.
metric for people in terms of feeling better can be feeling lighter, feeling brighter, feeling like they can engage in their life in more
Mm.
effective ways, in their relationships in more effective ways. It really, the end point for people is not the same from person to person.
Yeah.
So it's very individual.
Yeah, it's very, very individual. So do you see yourself building centers outside of the boroughs, potentially?
I hope so. I hope so. It just, takes time and we're focused on sort of optimizing the ones we have. But
Yep.
yes, I mean, down the road, yes, absolutely. As we grow and sort of, we'd like to make it more accessible.
Yeah, well, I think getting insurance reimbursement, such as it might be, is always a help for individuals just because it's easier potentially financially.
And one other thing that I think we do that makes it just more accessible is we're open on the weekends and the evenings. So for people that work or have kids or have other commitments, coming on a Saturday or a Sunday or, in the evening, we're open till 8:30 every night, pretty much. So, depending on the office, but, in general, those are our hours. And I think hopefully that sends a message that we're trying to work with our patients and understand that, they could be juggling a lot of different things. This should be hopefully one of their priorities. So,
Yeah. Yeah, no, I think that's great, and I think everybody, at least has a new view on ketamine particularly and how it may help and how it might be something that if they're struggling, that's might be a good choice to go look at next,
right.
for sure.
Absolutely.
Yeah,
Yeah.
well, thank you, Dr. Haviva, for being on.
Mhm.
This has been great. And
Thank you.
everybody, give your website address again one more time so everybody
Yes.
can find it.
Yeah, sure. It's ketamc.com. You can call our office, email any of the ways of communicating, and we'll be right back in touch with you with next steps.
Fantastic. Well, thank you so much for being on Menopause Mastery.
Thank you for having me.
Okay. And thank you, everybody, for listening to Menopause Mastery. And if you found this to be a fabulous, fabulous episode, please share it with a friend because together we rise.